Hey, and welcome back. Dr. Dave here, seeing patients in the office for a change. Hi, good one. And wanted to tell you what's on my mind, and I think where we're headed with the COVID-19. Saw a young man today, about 25, sad, pitiful, desperate. Been sick about 10 years, so imagine that. 25-year-old, sick 10 years. And he's been to dozens, lots of physicians and clinicians. He's been given multiple diagnoses, many different types of treatment, none of which have really helped, leaving him to this day with lots of symptoms: fatigue, lethargy, brain fog, no joy. Fancy term for that is anhedonia. He's just numb, he's flat, he's got nothing in the tank. And at the same time, he has trouble falling asleep because of anxiety and fear and worry, right? The regrets of yesterday combined with the fears of tomorrow are more than today can handle. Sir William Osler. Now, I asked him, well, what started all this? And naturally, what hopefully will go through your mind, and certainly went through my mind, is something happened, some trauma. Well, there was nothing physical, no head trauma, there was no psychological trauma, no relationship disruption, but he did have an overwhelming infection. It wasn't nearly fatal, but it just was some likely viral insult. Never found out what the bug was, but he's not been right since. There is something in the literature, and you heard it here first, called immunological dissonance. Immunological dissonance. And I see it all the time, whether that's a post-strep kind of phenomenon, a la pandas, or whether that's the cause of certain types of autism, whether that's the cause of certain types of schizophrenia, whether that's the cause of certain types of chronic fatigue syndromes, even PTSD syndromes, who knows, right? But there is this post-insult, in this case likely viral. I've seen it with fungal and bacterial infections as well. I've seen it with head trauma. I've seen it with lots of things. So insult, and then your body's immune system is never right after that. All right. Now, where does that take us today? I expect, worry about, predict actually that we're going to see a lot of post-COVID-19 immunological dissonance that's going to cause people to seek medical help, and they're going to go to the organ cartels. If you go to a gastroenterologist, you'll get a GI diagnosis. If you go to a psychiatrist, you'll get a psychiatric diagnosis. If you go to a neurologist, you'll get a neurological diagnosis. You're starting to see the picture. And no one is going to be talking to one another. If you go to a doctor of the right big toe, that'll be a diagnosis. If you go to a doctor of the left big toe, you'll get a different diagnosis. That's why I like to practice an integrative approach. And I'm going to look more at your pathophysiology, i.e. what's wrong at a neurotransmitter, a hormone, an immune reactivity, adrenal level, than simply at your diagnosis. What does that really mean, and how am I going to try to help this individual? Well, let's just take some of those symptoms. What might it be? Well, if I just focused on the anxiety and the insomnia, then I could give him a diagnosis of insomnia, a description, anxiety disorder, a description. Some people have called them depressed, a description. Others have said, well, this is chronic fatigue. Again, a description. What does all of that have in common? Well, no one really knows, and no one's really looking, no one's really asking. What it tells me, however, is he's got that mixed, wired, and tired profile, right? The one that needs a little bit of speed in the morning and a little bit of weed at night. A little Adderall in the morning, a little Ambien at night. A little puppy upper in the morning, a little doggy downer at night. A little whatever. Black coffee in the morning, as I've shared with you, red wine at night, right? We're all doing the same thing. This is just an exaggerated example of that immunological dissonance, which is then causing myriad perturbations among various other physiological systems to include your neurotransmitters, your adrenal output, and your hormones. Okay, well, I'm going to look at all that stuff. And I'm likely going to support his serotonin because I think low serotonin is driving his worry, anxiety, and insomnia, at least in part. Probably going to support his GABA as well, gamma aminobutyric acid. I have ways of doing that with medications, or more accurately, probably more likely with supplements. Again, I'm not treating a diagnosis, not off label here, because I'm treating pathophysiological specific abnormalities, and then I'm treating your symptoms. Okay. Hopefully farther upstream than most of our modern medications attempt to do. Now, what about that fatigue and anhedonia and lethargy and brain fog? Well, that's likely to be poor adrenal output. I'm going to fix that. It's also likely to be low dopamine, low norepinephrine, low PEA, phenylethylamine. I'm going to fix those things. Now, my clinical sniffer tells me that that's what's likely, but I ain't going to always trust my clinical sniffer alone unless I have to, so I'm going to what? Measure all of those things, right? So it's the old test, don't guess adage. So that's what I'm going to do. All right, I have an approach. I'm not saying it's better than anyone's. It's just likely different from most people's, and certainly different from what you've had, and different from what my young man today has seen in over a decade. And why not? If it's not working, try something different. All right, sorry, a little preachy. That was just fresh on my mind. Heard it here first. We're likely to see a spate of post-COVID-19 immunological dissonance, which is going to show up as all kinds of funky and mixed symptomatology. All right, I'll talk to you later. Peace out. Oh, be safe and stay sane.